Menopause affects every organ system in your body, and your skin is definitely not the exception. So in menopause, people can suffer from hormonal acne, skin discoloration. They can have weird hair distribution and hair growth throughout their body, and they can suffer from rosacea. Today's video is going to talk about menopause rosacea. Rosacea is a skin condition. It's an inflammatory skin condition, actually, in which your skin, particularly your cheeks and your nose, become extremely red and inflamed. Now, common markers or indications that you have rosacea are when you can see blood vessels, tiny bumps, and sometimes they're filled with fluid as well. And you just have kind of a general skin thickening around this portion of your face. A lot of people mistake rosacea for hormonal acne or just generalized ruddiness, but it's really important to seek medical care as soon as possible, and by that I mean seeing a dermatologist, to get a grip on rosacea, because if you do not treat it, it can lead to permanent skin thickening and scarring. So many women wonder, can perimenopause cause rosacea? And the reason they ask this is because rosacea most commonly affects women over age 30. It is also higher in women with lighter skin, although it can affect anyone of any skin color, any age, and even any gender. Our skin is often a window into our health, and it frequently reveals any hormonal changes or disruptions that we have. So think of hormonal acne. But remember, rosacea isn't acne. It's an inflammatory skin condition, and hormone changes can certainly cause your skin to become inflamed, and it can also affect the way that your skin secretes oils and your skin's dryness and moisture. So women in perimenopause, again, are definitely more prone to having rosacea, but there's also certain correlations with other perimenopause symptoms that can actually worsen rosacea. So hot flashes and anxiety and stress can all exacerbate rosacea. And hot flashes in particular is interesting because it's the heat that generates the redder skin and the more dilated blood vessels. So if you're trying to figure out how to control perimenopause rosacea, the good news is there are ways to manage it. So definitely connect with your dermatologist as early as possible to make sure that you are taking the right steps to preventing any permanent thickening and scarring in your skin. While you're waiting for your dermatology appointment, make sure to take some early steps to try to decrease the inflammation as much as possible. So first of all, try to avoid your triggers. There's certain triggers that can actually aggravate rosacea. So drinking alcohol, especially red wine, is one of the big ones. Hot and cold temperatures and extreme climate changes as well, such as really windy or snowy days. And also spicy foods and stress and anxiety can also exacerbate rosacea. Now, also make sure to wear a good sunscreen. That's important for skin health in general, but especially in preventing worsening of rosacea. Finally, also make sure to do good skincare practices. So use really good products that are really low in ingredients and chemicals and are just very gentle on your skin. Also wash your face with lukewarm water, again, to prevent that heat that dilates those blood vessels. Again, early action is key in preventing rosacea, and it definitely is manageable if you're struggling with it in perimenopause.